Good morning, everyone. We'll start today's COVID-19 press briefing with Mayor John Cooper and Dr. Alex Johanger, Chair of Nashville's Coronavirus Task Force and Chair of the Metropolitan Board of Health. We will also hear from Dr. Gil Wright, Interim Chief Medical Director for the Metro Public Health Department, and Dr. Virginia Debermudez, Program Manager of the Family Champion Center for Health Policy at Meharry Medical College. Here to help answer your questions today will be Director Chief William Swan of the Office of Emergency Management and the Nashville Fire Department. We'll now begin with Mayor John Cooper.
Good morning, Nashville. I'd like to start today's briefing by discussing our reopening strategy and then Metro's vaccine rollout, and give an update on our Second Avenue recovery efforts. Now, the Biden administration has embarked on a wartime effort to fight COVID, and that includes quickly ramping up the production and distribution of more PPE, but most importantly, more vaccine. This new federal COVID strategy is welcome news, since we have much more capacity to immunize our residents than current supplies allow. Meanwhile, our COVID metrics continue to improve. This morning, Nashville is reporting 4,774 total active cases, and this is a 44% improvement from the January 11th peak of over 8,500 cases. Today, Public Health is reporting a 7-day average of 58.2 new cases per 100,000 residents, down from 72 just last Thursday. Now, our 7-day positivity rate is 11.2%, and that's a 2.6% improvement since last week. And our transmission rate has reached 0.83, which means the rate of coronavirus spread is still slowing down. Now, in Nashville, hospitalizations have dropped by 36% from the December peak, and our case fatality rate is half the national and state average. Now, Public Health feels we can safely take a small step towards normalcy and adjust our public health protocols. Nashville will move the closing time of restaurants and bars back by 1 hour starting Monday, February the 1st. New patrons will be allowed to enter until 11 p.m. rather than 10 p.m., and closing time will move from 11 p.m. to midnight. And restaurants that do not serve or permit alcohol may resume regular hours of operation, up to 24 hours a day. These slight adjustments will help our hospitality businesses, while social distancing and capacity rules remain in place and will be enforced to keep everyone safe. I'm grateful to the Hospitality Advisory Committee for their work in this area. Now, our conditions have also nearly improved enough for the in-person learning option at MMPS to safely resume. The rate of disease in Nashville is improving. We have more resources to safely reopen schools with the support of a new federal COVID strategy. And like other cities, we know more about how the disease spreads than we did before. We're working with Public Health and MMPS to evaluate the timely and responsible return of an in-person learning option on a daily basis. Current case trends will allow MMPS to have an in-person option very soon. But let's keep the numbers moving in the right direction by masking up, even if you've received the vaccine. And continue washing your hands, social distancing, and get tested if you feel symptomatic. Now, here's a brief update on Nashville's vaccine rollout. So far, the state has received 713,000 total vaccine doses from the federal government. That's an increase of 138,000 since last week. In Nashville, we are continuing to vaccinate Phase 1A recipients and seniors 75 and older. As a reminder, Phase 1A includes 75,000 people who live and work in Davidson County, and our 75 and older resident population is 34,000 Nashvillians. Combined, this first phase in Nashville includes 109,000 people. Now, 81,428 total doses have been administered in Nashville by all health providers for these categories. Now, of this total, Our own health department has administered 13,208 doses. All the other doses have been given by our healthcare, hospital, and nursing home partners. In Nashville, about 24% of our 75 and over residents have started their vaccinations. Now that's up from 13.4% last Thursday. So we are greater than 90% complete with our non-senior Phase 1A first responder vaccinations for Davidson County. To be added to the 75 and older waiting list, visit covid19.nashville.gov or call 615-862-7777. Now, Phase 1B includes teachers and child care workers, and that's our next priority group. We hope to start this phase in February, but the timing of these doses depends on the amount of vaccine we get, a number, frankly, that can change day to day. Simply put, we need more vaccine, and I'm hopeful that the federal government will increase production. Nashville is ready. And we're committed to transparency. If we have to adjust our expectations, we will always let you know as soon as possible. Now, this weekend, Metro will begin vaccinating those with appointments at the Music City Center. Depending on vaccine availability, Public Health is planning to administer 1,000 doses a day, 7 days a week. The opening of the Music City Center vaccination site gives us even more capacity to immunize our residents when we begin receiving more vaccine. But until our weekly shipments increase, we will be constrained by the number of doses we receive each week. Now, Nashville will continue to use every dose we get as soon as we get it, while following CDC and state guidance. Dr. Gil Wright is here this morning to discuss this exciting change in more detail, as well as the different variants of COVID-19 that have emerged recently. Now, it's also my great pleasure to welcome Dr. Virginia de Bermudez of the Center of Health Policy at Meharry Medical College. She's here to provide a Spanish language vaccine update and remind our Hispanic residents about the importance of choosing vaccination when their turn comes. Last Friday, I hosted the first of what will be many meetings on the historic downtown community to envision the rebuilding of 2nd Avenue. We will meet again tomorrow morning at 10 a.m. The discussion provides Metro departments and 2nd Avenue property owners the opportunity to share updates and ask questions. We will listen to all Nashvillians who want to have a voice in this process. Metro Planning is currently working with the Downtown Partnership, the Civic Design Center, and the Urban Land Institute to host a series of listening sessions that are open to the public. We will have more information about these listening sessions and how you can attend after tomorrow's meeting. Now, today, I am pleased to introduce our hero of the week, Lisa Gubert. Lisa is a writer and children's librarian at the Nashville Public Library, Madison Branch, who delivers weekly virtual story times for families. The pandemic hasn't stopped our librarians and our library volunteers from reading with children. And we will need our libraries to help students catch up from an academic year unlike any other and restore a sense of community across Davidson County. I am grateful to Lisa for her dedication to our children and their reading enrichment during this challenging time. Now I'll turn it over to Dr. Alex Johanger, Chair of the Metro Coronavirus Task Force.
Good morning, Nashville. Here's the latest on coronavirus. We've had 541 new cases since yesterday for a total of now 83,768 infected individuals in Nashville. Our rolling 14-day average is 443, which is down from 583 last week and 683 the week prior. This now allows us to put our 14-day new case trend in the green on our key metrics dashboard. Total number of tests conducted in Davidson County has now hit 915,000. Our hospitalization rate in Middle Tennessee is now 615, down from 795 from our last update, and in Davidson County is 378, down from 483 in our last update. Just a few weeks ago, on January 6th, we hit our peak hospitalization in Davidson County of 597 people. And I'm really glad that this number is improving. I also am excited that because of our partnerships with the health systems, if we have a surge again, we will now be able to better serve the people of Middle Tennessee. 571 Nashvillians have died as a result of this virus. Now on to the vaccine. Davidson County continues to be in phase 1A2, as well as vaccinating those 75 and older. This phase includes healthcare workers, long-term care residents and staff, first responders, mortuary workers, and all individuals over the age of 75. So far, close to 40,000 residents of Nashville have received their first dose. That means close to 6% of our population has started a vaccination program. This is exactly in line with the national numbers as well as the state numbers, where about 6% of Tennesseans and Americans have received at least one dose. Of the 40,000 residents, 8,100 or 20%, approximately 20% of people over 75 have received the vaccine, and of the 40,000 individuals, more than 16,000 have received their second dose. As we are allotted vaccines, we will get them in arms, and we have a plan to give them out within a week or so after receiving them. Right now, through our partnership, we're giving about 7,000 vaccines a week. We can easily do 3 to 4 times this number weekly if we get the vaccines. This week, we began distributing vaccine to 11 federally qualified health centers in Nashville, as well as Siloam Health, to ensure that vaccines get to as much of our city as possible. We continue to work with the state on getting more vaccine, and as we get them, we will distribute them to these community partners. The supply is a single limiting factor in us getting our residents vaccinated. Now, an update on our community assessment centers. Consistent with our cold weather protocols, the Meharry and Antioch sites are closed today due to cold temperatures. The Nissan site, located in Lot N, will be open from 10 a.m. to 3 p.m. We will continue to update daily on the sites, so please continue to monitor social media and call the information line at 615-862-7777. The numbers continue to be encouraging. The transmission rate, the 14-day rolling average, and the 7-day positivity rate in hospitalizations are improving. Let's keep going by doing what we do. Stay apart, wear a mask, keep your distance in public, and wash your hands. If you have any concern about being infected, get tested. And remember, if you test positive, ask about monoclonal antibodies. It literally may save your life. When it's your turn, take the shot, get the vaccine, and encourage others to do the same. It's the biggest thing you can do to win this fight. I now would like to turn it over to Dr. Gilwright.
Thank you, Alex. Good morning. There continues to be interest in the new COVID variants that have been identified in a number of states, including here in Tennessee. We have not had any cases here in Nashville to date. These new variants have shown to be 30 to 70% more contagious, and this is a serious reminder that we cannot let our guard down. We need to continue to wear our masks, stay socially distanced, minimize time together when possible. Outdoor and well-ventilated areas are preferred. Wash your hands, get tested if you have a concern, get your vaccine when it becomes available. In regard to vaccine, there's a change in our vaccination clinics. I'm grateful for the support of the Office of Emergency Management with securing the temporary vaccine location in East Nashville. Nurses at that location and the Lens Public Health Department have been offering the vaccine in phase 1A1 and 1A2 and to those 75 and older based on appointments. The health department wants to be as prepared as possible as we anticipate an overall increase among those coming for their second dose while we are continuing to provide first doses. We're also hoping to see a steady increase in the number of doses of vaccine in the coming weeks and months to allow us to move to the next phase of the vaccine rollout. For that reason, OEM has helped us secure a larger location where we can continue to offer the vaccine in a central location with ample covered parking and space inside for appropriate social distancing. I'm happy to announce today that this weekend we will begin our transition to a location inside the Music City Center. Vaccination at this site, like all of our sites, will be by appointment only. Please do not come if you do not have an appointment, as you will be turned away. Vaccinations that are offered to 1A1 and 1A2 at the East Nashville location will end on Friday. Beginning Monday morning, February 1st, those vaccines will be offered Monday through Friday by appointment only at Music City Center. Those 75 and older with an appointment for their first dose of vaccine this Saturday and Sunday, which is January 30th and 31st, will be vaccinated at the Music City Center. For those 75 and older who are to receive their second doses this Saturday, January 30th and 31st, they are to return to the Lentz Public Health Services or Health Center. Beginning Saturday, February 6th, all first and second vaccinations of those 75 and older will be given at Music City Center. This will be the case for all future weekend clinics. Vaccine availability is still a challenge. There are clearly more people that are eager to get the vaccine than we have doses available. For those of you that have signed up on our wait list, please continue to be patient. You do not need to sign up more than once, and someone from the health department will be contacting you as we are opening appointments. Health department staff is currently contacting people on the wait list and scheduling these appointments for those that are still on that list. Now, I would like to turn it over to Dr. Deborah Mudez, who will share her comments in Spanish.
Buenos días, Nashville. Soy la doctora Virginia de Bermúdez y soy directora de programas del Centro de Políticas de Salud en Meharry Medical College y portavoz de la comunidad hispana latina de Nashville. La vacuna COVID-19 es una forma segura de ayudar a protegerse a sí mismo y a sus seres queridos de este virus. Estoy feliz de estar con ustedes hoy y compartir parte de esta información. La vacuna se está lanzando en fases y actualmente estamos vacunando a aquellos en la fase 1A y a los mayores de 75 años. El Departamento de Salud Pública de Metro y los sistemas hospitalarios locales siguen ofreciendo vacunas con cita previa a los que se encuentran en la fase 1A1 y 1A2. Las personas elegibles incluyen trabajadores de atención médica de primera línea, socorristas, quienes trabajan en funerarias y personas de 75 años o más. Si tiene preguntas sobre la vacuna o su seguridad, por favor, hable con un profesional de la salud de confianza. Si no tiene un profesional de la salud de confianza, puede comunicarse con una clínica de Meharry que ofrece muchos servicios a las comunidades hispanas, latinas y desatendidas. Meharry es un defensor de la salud dedicado para la comunidad de Nashville. Cada año, Meharry brinda atención médica y dental a los miembros de la comunidad de Nashville a un costo reducido o gratuito para el paciente. Además, Meharry sirve a la comunidad a través de una variedad de programas que ayudan a las poblaciones desatendidas. Uno de esos programas es Bridge to Success, que existe para asociarse con las familias, para crear un legado de seguridad económica que pasa de una generación a la siguiente. El plan de distribución de vacunas de Nashville se comunicará a través de las reuniones informativas del alcalde Gubert y a través de el www.covid19.nashville.gov, que tiene una página en español. Esta página también proporciona un enlace para programar una cita para recibir la vacuna. Los medios locales en español son actualizados por el señor Fabián Bene, el cual trabaja en la oficina del alcalde, quien tiene una conferencia de prensa semanal en español. Por favor, recuerde que es muy importante seguir utilizando el tapabocas, practicar el distanciamiento social, lavarse las manos y hacer la prueba. Las máscaras o tapabocas y el distanciamiento social ayudan a reducir la posibilidad de estar expuesto al virus o contagiarlo a otras personas. Más información sobre las pruebas están disponibles llamando a la línea directa de COVID-19 en el 615-862-7777. Gracias. Thank you.
We'll begin taking questions now, starting with Jeremy Finley. Good morning, Jeremy.
Hey, good morning, everyone. Mayor, everyone, thanks for the updates and taking our questions. Mayor, I wanted to ask about a COVID-19 related issue. There's been a lot of frustration this week from Metro Parks employees who were told they had to repay their COVID-19 hazard pay bonuses, all because of a mistake made by a Metro department. So I wanted to ask you, do you think it's fair that these employees have to pay back this bonus even though they didn't do anything wrong?
Well, thank you, Jeremy, for that question. And I think the specifics is the extra bonus. It was a bonus beyond the regular emergency responder bonus. And let's just start this out. This is no fault to our Metro Parks employees who have been great throughout this panic. And we appreciate the additional risks that they took to keep our park system going, and the city's never needed its park system more. We probably do have to try to recover the overpaid funds because there are federal dollars and there are federal rules. And we're going to be responsible stewards of the federal money that has been given to us to pass on to them. But we're going to do this correction as compassionately as possible and in a way that lessens the impact on our valued employees as much as possible. And I think between Parks and Finance, hopefully we can work out a good strategy for that. Thank you.
Our next question is from Dennis Ferrier. Good morning, Dennis.
Hey, good morning, Brian. I have a couple questions, one for the mayor. You talked about reopening schools, two kind of phases of that. You said very soon, and obviously you don't have a date or you would offer that, but what does very soon mean? 3 days, a week, 2 weeks? And will it be staggered again, or are we going to look at an in-person option K through 12 with that reopening? Thanks for answering that, Mayor. And then for Dr. Johanger, you're an esteemed member of the Vanderbilt Children's Hospital. I know you have colleagues there. I just wanted your reaction to two of your colleagues there, epidemiologists Buddy Creech and Catherine Edwards, held in high esteem, who have both urged in-person school. And with the report yesterday from the CDC, I believe the headline was "Scant Evidence of Transmission Within Schools When Masks Are Worn and Other Protocols." Just your thoughts on reopening schools as soon as possible. Thank you, gentlemen.
Well, Dennis, I appreciate your question. It's exciting to be able to talk about getting our schools back to having a in-person option like we did last fall, but hopefully ultimately this will be broader. A lot of this, I think, does depend on our disease numbers, which there's clearly an optimistic trend happening right now, and then also our vaccine rollout. I mean, it's great to be talking about teachers getting their vaccines in a matter of days or weeks. Now, MMPS is fundamentally in charge of its own reopening schedule, and I know the school board on Tuesday spent a lot of time on that. For us at the city level, we need to get them the vaccine, we need to get the disease under control, but our top job is going to be how do we plan for recovery, learning loss recovery, and how do we get every student to make a full academic comeback. So it goes not only to the reopening, but then our response to the last year and how to do that on a student-by-student basis. And I know that's Dr. Battle's plan, that every student has a learning recovery plan, and the city, I'm grateful to the federal government, frankly, for putting in a lot of money in this area that will allow a robust recovery, and that's something that we have to plan for too, with the general excitement, I think, of feeling that an in-person option hopefully is beginning to be just around the corner. Thank you.
Our next question is from
Hold on. I have a...
Oh, sorry. Sorry.
Yeah. So, I first of all completely agree with you. Dr. Creech and Dr. Edwards are amazing, esteemed colleagues at Vanderbilt who've really looked into this issue. Listen, I do think schools should reopen with the protocols and the resources that are needed in each situation of each school to reopen safely. So I think I echo a lot of what the mayor said, and I think if each school has to evaluate their situation and make sure that there's they have the right resources to reopen in a safe manner. But so thank you.
Now our next question is from Blake Farmer. Good morning, Blake.
Yeah, good morning. And I may just sort of keep on the education theme, since I think it's on the minds of so many. And I guess I'll ask this directly to the mayor and to Dr. Johanger, and that is, have you all advised the school district to reopen with in-person learning, with any sort of certain date, or that it should happen? I'm just trying to understand what the resistance is, in essence.
Well, thank you, Blake. I'll go first. I think it's not inappropriate to acknowledge how bad our numbers were very recently. In this optimistic moment, it's we should also have to look back and acknowledge the terrible numbers that to some extent we still have. I mean, there's a time that if you were in the 50s per 100,000, boy, that clearly indicated community spread. I think that vaccination gives us optimism. And so we need to use that, but we need to be ready. Reopening schools is a big project, but I know that the school system is working on a daily basis. But the time clearly is coming where we can have an in-person option, and we want that to be well done. And I talk to the school system on a daily basis. There's two parts of this. One is to get reopened, and the other that I also know that they're working very hard on is a student-by-student plan for success, and to understand that the 12 months ahead will also be dedicated to doing that. And that's going to need the support of everybody, our library system, our staff, et cetera, to make sure that by the fall of 22, our students are all back on track. And that's, I know, something that the school board and the school system is completely dedicated to.
Yeah, and like I'll say is, I know that Metro Public Schools is working on a protocol. They've worked with some of my colleagues in Metro Public Health, as well as some colleagues from Meharry, to figure out a plan. The part of it that I'm more involved with is helping figure out how and when we can get people vaccinated in Group 1B, and I'm working with, again, my colleagues in Public Health to try to do that. So that's been my involvement. Thank you.
Our next question is from Neri Vargas Ortega. Good morning.
Good morning. I'm Neri Vargas Ortega from Extrema TN Hispanic Digital Media. My question is, do you will provide interpreters in Spanish at the sites where you will vaccinate to help the people on the Hispanic community to understand the process and feel comfortable to have the answer to their doubts?
That's a great question, and yes, just like we've done in the testing centers to make sure that we're able to answer any questions or have a conversation in Spanish, we are doing the same with when we're doing the vaccination clinics as well. So yes, it is something that's important to us, and that's something that we will continue to do. Last question is from Brett Kellman. Good morning, Brett.
Good morning, everyone. So I was going to follow up on education, but a lot of those questions have been asked. So instead, there has been a lot of national reporting in the last few days about the expected rise in vaccine reserves next week and in the weeks that follow. I'm curious if the city government has gotten any concrete assurances or numbers from federal officials or state officials that you will have more vaccine next week above the 5,300 doses you've been getting weekly. Anything solid?
Dr. Wright will answer that, Brett.
Well, Brett, that's a great question, and actually we've already seen a little bit of that increase. We had been receiving about 5,300 doses this week. We received 7,200 doses. We distributed 1,200 of those doses to federally qualified health centers and Siloam to be able to help us with certain populations. But beyond that, we have not yet seen what our next allotment will be, but I'm very optimistic, as the Biden administration has said, that we will know 3 weeks out, and that they're going to try to continue that 3-week out time frame, which will help us be better able to plan. Thank you.
Thank you, Dr. Wright. Those are all the questions we have this morning. I'd like to thank Dr. Deb Bermudez for joining us today. We're grateful to Amy Lankite and our partners at Bridges for the Deaf and Hard of Hearing for providing the ASL translation at these press briefings. The next COVID press briefing will air on Thursday, February 4th at 9:30 a.m. Thank you for joining us, and this concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.